Hello, everyone, and welcome to the Securing Your Business webinar series. My name is Amy Morgan, Associate Vice President for Programs at the Winter Park Chamber of Commerce. We're glad to have you here, whether you're watching on Zoom, on Facebook, YouTube, or at winterpark.org. We have a great program for you today, and without further ado, we'll go ahead and jump right in. I'd like to introduce you to Betsy Gardner-Eckbert, our President and CEO. Welcome, Betsy.
Thank you, Amy. I'm thrilled to be with you all today, and we have amazing partners in Orlando Health that I know are going to share some really great updates with our community today. They are terrific community partners, and we're so fortunate to have them with you today to let you know about resources that they've got. This series is really all about living out our mission, which is to convene people and ideas for the benefit of our business and our community here in Winter Park. And it's been a challenge in this pandemic time to think about ways to do that. And we're grateful to those of you who've been joining us in the afternoons to learn more about resources in our community that will not only help your business function, but to keep our economy robust and thriving. So we've had speakers ranging from United States Congresswoman Stephanie Murphy to our Mayor Steve Leary, to resources to help people navigate legal, HR, and other issues during this unprecedented time. So we will continue offering these webinars, and we are thrilled to be with you today. We have several people on our panel that are going to bring you up to speed in terms of the capability of Orlando Health here in our community. And I'm pleased to welcome our panel. We have Thibaut Van Mark, who's the Senior Vice President of Orlando Health, and he's the President of the Dr. P. Phillips Hospital. Thibaut, prior to his current role, was Vice President and Chief Operating Officer for HCA, North Florida Regional Medical Center in Gainesville, where he was responsible for all hospital operations, including executive oversight of surgical services, cardiovascular services, and all ancillary and support departments. He holds a bachelor's degree from the University of Richmond and a master's of health administration from Virginia Commonwealth University. We also have Dr. Donald Plumley, who's the Chief Quality Officer at Arnold Palmer Hospital. He's a pediatric surgeon, and he is certified by the American Board of Surgery with a specialty in pediatric surgery. He is the Pediatric Trauma Medical Director, as well as Chief Quality Officer at Arnold Palmer Hospital. Dr. Plumley earned his medical degree from the University of California, Irvine. He went on to complete a surgical residency where he served as chief resident, followed by a fellowship in surgical metabolism and critical care, both at the University of Florida, Gainesville. He also completed a pediatric surgery fellowship at the Indiana University School of Medicine, Indianapolis. And just to prove that we've got absolutely no losers on this panel, we've got Andy Gardner, Senior Vice President, External Affairs and Community Relations, who joined Orlando Health in June of 2008. He oversees the strategy for corporate external affairs and is responsible for all community and business relations activities for the organization. Previously, Andy was the president of the Apopka Chamber of Commerce, a position he held for 10 years, and he is a former member of the Florida State Senate, where he served as president from 2015 to 2016. He holds a Bachelor of Science degree from Stetson University, and we are absolutely thrilled, gentlemen, to have your expertise and time today. Thank you so much for joining us. Can we see all of you? There they are in their glory, the Orlando Health panel. Thank you so much for making time this afternoon. We are aware that the NASA, the SpaceX launch is going to go as scheduled, so we're conscious of time, and we're actually going to have that hopefully up for a feed for you all at 4:30, which is the expected launch time. But first, we want to hear an update on the hospital system and COVID-19. Who would like to kick us off?
I'll get started. Betsy, thanks so much for having us. It's really a pleasure to be with you all today. I appreciate the opportunity to share some of our experience as we've dealt with the COVID-19 pandemic over the past several months now. Really dating back to mid-March or so when all things kicked off, we saw a surge locally in the beginning of the second week of April. Around April 9th is really where we saw kind of peak volumes across our health system, and we've seen a steady decline over the last 6 weeks or so. At our peak across our 7 hospitals, we had just a little more than 50 total COVID positive patients. That we hit a low of 5 just a few days ago. We have seen a little bit of an uptick back up of positive patients, though total number of patients on ventilators has not increased, which is good news. And what I'll say is, again, knowing that we're sensitive to time, we want to talk about maybe some takeaways. I think a lot's happened in the last 2 months from a preparedness perspective. We've learned a lot from those early experiences, and our hospital teams and healthcare professionals are I think well prepared. Our infrastructure is a lot better prepared today than we were certainly 2 months ago.
That is great news for all of us in the region. And we've felt particularly fortunate to be in collaboration with Orlando Health because there's so many businesses that are struggling with how do we reopen? What are the strategies to reopen? How do we reopen without incidents and liability? And I understand that you all launched a task force devoted to supporting the business community. Why was that a priority for the hospital? And tell us a little bit about who's involved in that work.
Andy, you want to go ahead and take that?
Yeah, so probably 3 or 4 weeks ago, David Strong, our president, had asked for a group to get together, and really what drove it was being able to share with businesses our experiences, our expertise, our doctors, our Dr. Plumley and others, and really explain, these are the situations that we faced, and here's how we can help. And so the committee is chaired by Thibault and Dr. Plumley, who's also on the call. And it really has given us the opportunity to give back to the community. The underlying view is in order for us as a healthcare system to be successful, the business community has to be successful. And so we launched this initiative, and it's been well received. And the website, just see everyone has it, is orlandohealth.com/business ready. And maybe we'll have a few minutes to talk about some of the content there, but then also to offer the chamber members, if there's an interest, there's an opportunity to ask questions there. And if they would like to talk to us directly, we are happy to do that to help them get up and running safely.
Well, we've shared some of that content, Andy, and we're grateful for it. Really grateful to have you all here to answer some of those questions, because what we're hearing is people have a desire to open their buildings back up, but they don't really have the knowledge of how to do that safely. So this is a great resource. Can you flesh out a little bit for us what some of the content points are in Business Ready? Because we've shared that, and it's impressive what you all have done.
I'll jump in and handle this one. This is
Great.
Don. What we really felt is that, first off, we had lived through this at the peak of it, having to take care of our team members and visitors as well as patients. So we thought we had some really good experience to share to build confidence back in the community. So some of the things on the website is we're being instructed by governmental agencies and whatnot on what to do in these situations, but just very vague rules. Wear a mask, wash your hands, sanitize. But to take that one layer deeper and really to explain to people how to do that mindfully. How do you appropriately wear a mask? What is the right way to wash your hands? Sounds simple, but not everybody knows that. How do you sanitize surfaces? How do you socially distance? So we really took a great pride in getting this website together, and it's really well done. There's videos, so employees and employers and even visitors to your business can look at it. There's PDFs that can be printed out that share the content, or videos or PowerPoints. And then the PDFs we have translated, I think, now into Spanish, English, Vietnamese, and what's the?
Haitian Creole.
Haitian Creole. So really available for all your employees and for your customers that come to see you.
Couldn't be a better time for that. And we're not all trained surgeons, Dr. Plumley. You've been taught how to wash their hands properly, but we probably need to right now. So that's the kind of tactical support I think people are really looking for, because the government guidelines are somewhat vague and our businesses need to really put kind of some meat on the bone. So I'm grateful to know that there's videos with demonstrations and printable PDFs that we can certainly share out with our membership. So if I'm a business leader or owner, how do you think is the best way to use these resources? Are people printing them for their employees? Are they emailing them to people? Are they suggesting to go on the website and watch these videos? Do you guys have best practice of what's worked well so far for other people in the community and leadership?
You know, Betsy, I think a lot of that's going to vary by business type and by employee type. And so I think all of those have been done, and we've had local businesses tell us that they're, taking the materials, the PowerPoints, and sending them to all their employees and asking them to go through the PowerPoint. The videos are essentially housed on YouTube, and so they can be distributed that way. And then, you've got smaller groups that are saying we're having them watch the PowerPoint, but then we're printing off the PDFs and putting that in employee break areas and whatnot. I think, I think along the way, one of our recommendations really is that it's really important for each business to develop a plan, and the plan that makes the most sense for them and for their client base. But I think one of the things that we did in our own organization is we developed a plan and we communicated the plan and we acted on the plan, right? And I think we made it very overt what we were doing so that people knew we were doing something different. If I could give advice to any business owner is develop a plan, put it into place, but don't be afraid to let people know what you're doing and just make sure it's being done consistently. And I think that a lot of the work that we're doing around getting not only our businesses, but folks comfortable with heading out of their homes and frequenting businesses they're used to is they want to know that they're safe, and they want to know that there's something that's different, right? That we've all reacted. And I think just being consistent with our actions is a key part of making people feel safe.
And we really appreciate this, especially right now, because without consumer confidence, we really can't engage in business. So this is such a critical way for you all to connect with the business community right now and help drive some of the behaviors that will increase consumer confidence. The research that we've been doing says simple things like watching people clean surfaces makes people feel more confident about being inside Publix and things like that. So it goes much deeper than that, as Dr. Plumley indicated, but those are the kinds of things that make people feel good about being in that place of business. So we're thrilled to be able to connect people to this content. What other services is Orlando Health considering offering to businesses in the future?
So I'll take this. So when you go to the website, there is a link that you can go to that deals with whether it's our telehealth opportunity or our COVID hotline. What we've encouraged business owners to do is to email us directly, specifically what it is that we can help with. Thibaut kind of alluded to having a plan and a business plan. There are several businesses and schools where we have actually reviewed their plans and given suggestions. The one thing that we talk a lot about when you put these plans together is the self-screening for employees before they even come to work, but also the cleaning of the surfaces. We've had a couple of plans submitted to us where we came back with both of those as recommendations, and proper use of gloves. I would encourage all your members to really take some time and look at those videos, and as Thibaut said, come up with a plan. I'm amazed now that being in healthcare as long as I have, really become a bit of an expert on watching people wear masks. And it's amazing to me how many people will wear a mask and assume, well, I'm wearing it properly. Those videos are very, very helpful, but that would be the one takeaway is to go to the site, and if you have a question, email us. We're happy to review plans and give you recommendations to successfully open.
That's really generous, because we're hearing so many. I've spoken with business owners over the past couple of weeks who were raring to go. They thought we'd get everything back open because we got to get these numbers back up, people back to work. And then they really thought about all the implications of opening back up and thought, not so fast. We actually might not reopen until Labor Day, right? And so that's what we're hearing is a lot of hesitancy from people who maybe 3 weeks ago thought, I got to get this show on the road, maybe really wisely pausing to take another look at it. And it's great to know that we've got you all available to that. People forget that Orlando Health is itself a business, and that at this time you all have not been able to perform the business functions of running elective surgeries and your normal operations. Can you tell us a little bit about what you're doing now that you're coming back online with that? What is that like? And what are you all doing to protect patients and visitors as that piece of your business comes back online?
I'll jump in on this one a little bit. So we kept our workforce safe throughout this. So again, we had that experience to build on, but we're pre-screening all people that come in the building. And I would say of one of the things on the website that's really helpful is that pre-screening questionnaire that your employees should use. I actually work out at a gym in Winter Park, and I shared it with them, and they sent it to all the clients. Before you come work out, answer these questions. If you're sick, don't come. So we do that with all our employees. We have them pre-screen every day. We do temp checks on visitors, but employees, it's on an honor system. You should check your temperature before you come to work. So we've kind of gone down that way. Now, this elective surgeries is a little different boat. Right now, we are testing those patients because it is an elective case for their own protection and the healthcare workers. But the testing isn't, it's for that moment in time. So you come in and get your surgery, you get tested right then and get your surgery. So the testing isn't a good screening, mass screening tool, but we do that to just more for the safety of the team members and the people undergoing surgery. So.
Yeah, and I would just real quick, Betsy, I would add to it. The one thing that we saw during the spike or the time period is, our view always was, if you're going to have surgery, it better be necessary. And we continue to encourage people, but as you can imagine, people put things off. And so we are now out marketing and letting people know it's time to go see your primary care physician, follow up with whatever was bothering you at the time, because of the number of people that were backed up. So we're starting to see that steady stream of our census numbers and others coming up. But I would encourage anybody that doesn't feel good, go check out what is happening, because it is safe and they need to take care of themselves.
Thibaut, do you have anything final to add to that piece?
No, I think like every other business, we're trying to figure out what our new normal looks like, right? And I think it's I think everybody's had to make an adjustment. And I think to Andy's point, I'll just reiterate. I think what's concerning for us is people avoiding, certainly leaving their homes, but avoiding hospitals because they feel like there's a greater risk of infection there, and it can maybe plug something there. I assure you there's no cleaner place around right now than the hospitals in Central Florida. We've been at this for 2 months now, taking extreme precautions, but it is concerning when we're seeing, patients showing up to our hospital while the total number of emergency room visits are lower than expected. We're seeing that patients are showing up sicker than usual. And that's indicative of people not feeling well and waiting days to come in. And if you're having chest pain, if you're having stroke symptoms, you shouldn't be waiting at home thinking you're safer there than seeking medical advice. So just reiterating that comment, and we want to make sure that that people get the care that they need so that they avoid potential more significant conditions down the road.
I think that's such a key point, because we're not all fully back to normal, but we can't neglect our health. So that's a really key message. I've asked Tiffany to put a link up in the chat to the Business Ready website, which she's just done. We want everyone on the webinar to be able to click right through to that. I know I've taken notes on the pre-screening questionnaire, and I'm grateful to Dr. Plumley for highlighting that. As an employer myself, I'll be hopping right on there and downloading that. That's a hugely helpful tool. And I know all of us wish we had a bit more guidance than we presently have from CDC, state of Florida, et cetera. So what an asset. We thank you all so much for being with us today. Any final thoughts, or do we have time for a few questions? I know we've got, I'm looking at the clock, 7 minutes till our little launch here. But I'll open it up in case there's any final thoughts or questions that you all wanted to share.
I'll go first. This is Andy. Thank you for having us. I just would encourage all the members to go to that website. If there's a specific question, don't hesitate to ask. I mean, we are here to provide support. There's no question that is unreasonable. If it's looking at a plan, we're happy to do that. If it's asking about statistics in the community on numbers, just whatever your members need, please don't hesitate to contact us.
Yeah, I think just adding to that, what we're finding is the needs of every business are different. And we're also finding that depending on the size of your business, you may have different resources. And we're finding that big businesses and small businesses alike, when dealing something like this that's outside of their area of expertise and outside their comfort area, it's easy to get a little bit lost. And so, we have a large cadre of experts. Again, we've lived it ourselves, and we're happy to share those experiences. What we found is that in many instances, it's, we end up with, a phone call or a couple of email exchanges to resolve a few issues. And then in some instances, it ends up developing into more than that, or we help folks find other resources that where we may not be able to help. So again, don't be afraid to reach out to us. We're here to help, and looking forward to working with the local community, bring us back stronger than ever.
Great.
And I'll just chime in here to finish it up. You can't you need to be this forward, front, hand washing, masks, social distancing. People are very critical of this, that public health is the new normal. So when people walk into an establishment, they're immediately looking for it. So these kind of the handouts and the printouts, it's okay to post them right in the public areas. They don't expect them to be back in your workrooms. When I walk in someone, I want to see they're washing their hands, they have sanitizer out, and people are wearing their masks appropriately. And that makes me confident in a restaurant, in a business or whatnot, that they're taking this serious. So I think that there's going to be this new hypervigilance of public health in the public's eyes going forward.
Well, and y'all can breathe a sigh of relief. Unfortunately, the launch has been scrubbed, so we're not as tight on time, but we do have a couple of questions. You've been kind enough to take those. I don't know what kind of time is involved, Dr. Plumley, in having a proper mask demonstration, but I noticed you've got one dangling there at your neck. If you wanted to show us really quickly a couple of pointers.
Let me grab it. This is a surgery mask.
Not often we have someone right out of Central Casting in the right outfit to demonstrate too. So this is pretty great. I'll give you a minute to prepare. In the meanwhile, I do have a question. Can you all speak to a potential second wave of COVID infections and what projections look like come the fall? Everybody get your crystal ball out. Let's hear what it looks like.
I'll take it while Dr. Plumley gets
easy lob. He gets to just demonstrate a mask. Y'all tell us the future predictions here.
No, I think the important takeaway as it pertains to a potential second wave is the fact that, until we get to a point where there is a vaccine and there is a known treatment, I think it's important that we all realize that we're going to be living with COVID-19 in our community for the foreseeable future. And that there are, this is not unlike other communicable diseases. We've experienced this in the past, and this just happens to be new, and we have less information. And so with that said, as states continue to reopen and life continues to resume with new precautions, it is expected that the transmission rates will increase to some extent versus conditions where everybody was or most people were home. I think what's different is when you look at the beginning of this, when testing was poor, there was very little known about treatment. Our healthcare systems across the nations were overwhelmed because we didn't have the equipment, we didn't have the knowledge. Now that we're a couple months past this, every hospital in the region has dedicated areas where potential COVID patients are being treated. It's being done safely. Testing has improved dramatically. So in 24 hours or less, we know whether or not you're actually positive or not. And if you're not, you get transferred out of that area. And if you are, then you get treated by healthcare professionals who now know what they're doing more so than we did two months ago. And so I think that's really important. And the other thing I'd mention is, the number of patients who have COVID is probably not the most important thing. I think it's important to look at how many ventilated patients we have, because that's really what's stressing the system. But I'll mention that as our testing capabilities have increased, even for those patients who have symptoms, the number of patients that are actually testing positive is very, very small. So over the last 6 weeks or so, for patients that are symptomatic, that are showing up to our ERs and getting tested, less than 5% are actually turning out positive. And so I don't want to minimize it, because I think that the precautions that have been recommended are really, really important. And the ones that you're going to hear the most about are hand washing, social distancing, and masking. If we can do those things with a high degree of reliability, it's going to keep the community spread to a low, and it's going to make things manageable.
Okay, Dr. Plumley, are you ready?
I'm ready.
I can't wait to see this because I have a surgeon friend that already complained about this. She said, "Oh, people are wearing these masks all wrong," and I thought,
it drives us crazy. It drives us crazy. Wash your hands.
Okay.
Get a real good-looking mask. They're hard to find, but pick something. Learn what's usually they have an inside-outside. Pick what color if it's homemade. After you wash your hands, you put it up over your ears, and then just adjust the nose so it doesn't. Coming off is the same way. You don't want to grab it up here because after you've been wearing it and had spray from other people or vice versa, take it off, place it down, wash your hands, and then wash them. The other thing is people have homemade ones and they wear them for weeks on end. We were laughing in the other day. We change our mask cover every single case. But what you don't want to do is you see people with this or they're touching their face a lot. And that's really what you want to do is to cover anything that you would expel and then not be touching your face, your nose, your mouth, and whatnot. So if you're in a deli and someone's like this, it's not reassuring to you. So people are doing it really well. Some of the places I've been out this weekend, a few restaurants and whatnot, and I think people are trying, and the establishments are doing it. It's usually the people that aren't doing it right are customers. You can't do too much about that. As long as your staff's doing it right and you're portraying this image that this is important to you, that's what matters.
So if you got a homemade mask, we want that washed about every day, probably is what you're saying, right?
Yes. Or get a cup. I mean, I've got 4 of them strapped on my backpack.
You know a guy where you can get a lot of masks? You seem to be well equipped with masks, Dr. Plumley. This is impressive.
Facebook. Etsy.
Well, Winter Park, you heard it here first, how to wear that mask right so you're not, out of the cool crowd getting your mask wearing done correctly. This is fantastic. Thank you for that demonstration. We have a couple more questions. I'm hearing conflicting information about temperature checks. For example, can they be wildly inaccurate? Anybody want to tackle that one for us?
Doctor?
Sure.
Great part of this panel.
Again,
you can just kick it over to him.
It really depends on your business. I think if someone's coming in and out of your store, the temperature checks, we're temperature checking people that are coming in and they're around immunocompromised patients and in the hospital. Maybe a school where you're going to put a lot of kids in a classroom, a daycare, it would make sense. But for in and outs, so the validity isn't that great. Are they wildly inaccurate? Probably depending on what device you're using. So it is meaningful if someone has a temperature. So we ask our employees, if you have a temperature over 100, don't come to work. Call our COVID-19 hotline. They'll ask you some questions, and then we'll decide whether you get tested, you quarantine, or you come back to work. So it is a screening tool, but it's right up there with a cough, travel, things like that. So on the website, I think it's 11 or 12 questions. I think it's important to go through any of those, and if your employees have those symptoms, to call in and discuss with their healthcare workers right now. And again, seek healthcare. Telehealth is a great potential right now. People can get in and see their primary care physicians pretty quick right now.
Okay, here's probably another one for Dr. Plumley. I had recently read that COVID-19 patients only have a fever 30% of the time. Do you see that or agree with that, or know literature that supports that?
It depends on where they are in the process. They will eventually, most of them have a fever, but they can be asymptomatic for a couple of days while they have the virus. And people are asymptomatic. So again, it's one of the screening tools. It's not an absolute. There's some vague GI symptoms. There are cough. But fevers are a part of it. I don't know the exact number. If you took all COVID positive patients, I would think it's higher than 30%. But in those initial stages, who knows?
Mm-hmm.
That's the kind of the danger zone. We're not sure how to, if we could identify if the minute you had a fever you had, it'd be easy. It's the asymptomatic person for a day or two that's potentially exposing other people. That's the hard part about this disease process.
Okay, and our next question, this one I love because I'm always wanderlusting all over the place if I can, and I'm not traveling right now. Do you think it will still be necessary to self-quarantine after an airplane flight within the United States?
I think it's an interesting question. What I'm hearing more, getting more traction about is that there may be a need to self-quarantine if you're traveling to and from areas that have higher incidence rates. So, as far as, blanket self-quarantine, I haven't heard that. And I don't think that's the direction that's being moved in. And I think, assuming that the proper precautions are being taken, again, I'm not a clinician, not an expert, but I think that those types of decisions are probably going to be made for us based on recommendations. Right now, there's still people doing some travel, and that's not, there is not a quarantine in place unless, again, you're traveling in and out of higher infectious rate areas.
Okay, a great sign of a great panel is a lot of questions. So thank you all very much. Any closing thoughts you'd like to share? This is the last call to our group for questions. If you have a question, put it in the chat box, and we'll remind you that we've already put up in the chat box, the Orlando Health website with the resources that we've discussed today. Couldn't be any easier for you to click right on into that from the chat box. And we are just so excited to have another Orlando Health presence in Winter Park. I know I'm jumping the gun about that one a little bit, but we have some really exciting things ahead of us in partnership with Orlando Health, particularly here in Winter Park. And we are always grateful for the really robust partnership we enjoy with Orlando Health. So I want to thank you all for taking time to be with us today. Again, it's not often that we get a doctor to demonstrate how the heck to wear a mask. So this was a pretty value-added afternoon for me. I appreciate it. Any final thoughts anybody wants to share?
Betsy, appreciate the support. Thanks so much for having us on. And appreciate you posting the website information, how to get a hold of us. I think there's some great resources out there, but if there's something that you need that's not on there, please, and we'll get you what you need.
Appreciate it. Andy or Dr. Plumley, any final thoughts?
Just real quick, Betsy, thank you for everything. Thank you for the friendship over the years. And on behalf of Orlando Health, we've always enjoyed the relationship with the Winter Park Chamber of Commerce, and we look forward to many more opportunities to spend together. So thank you for having us.
Thank you. We may have another episode where we have Dr. Plumley show us how to wash our hands. Are you up for that, Dr. Plumley?
I'd be glad to do that.
Volume
Thanks again.
2.
Yeah, thanks for having us. It's great to share it. It's Thibault and I's home community, so all the more special for us. So
thank you very much to all of you. And we just got a message from Khalid Munir to say thank you to all of you. We've had several kind messages in the chat box saying thanks. We really do appreciate the time and expertise, especially now as we're navigating these uncharted waters. So to let you all know what's coming up next, we've got Good Morning Winter Park next week. We're going to hear from the director of our library. That's at 10 a.m. on June the 5th. And we'll be continuing to communicate through our website at winterpark.org. And we are communicating twice weekly now. So our next newsletter will come out tomorrow morning at 7 a.m. Check that for more information. And we'd love for you all to follow us on Facebook, Instagram, Twitter, and LinkedIn. Many thanks again to Orlando Health. And we'll look forward to seeing you all, however virtually, very soon. Have a good afternoon.
Thank you.